Hi, my name is Sarah Bass. I'm an associate professor in the Department of Social Behavioral Sciences in the College of Public Health, and I'm the director of the Risk Communication Laboratory. I'm excited to be here today to talk a little bit about what risk communication is, how people assess risk, and how that's associated with their behaviors. I'll be relating this to the COVID-19 outbreak and talk a little bit about why people don't do the things they can to protect themselves. So let's get started. In general, people are resistant to risk. Although there are those crazy people who want to jump out of airplanes, most of us do resist risk. However, the weird thing is that despite that resistance, we also don't believe that we're at risk for things. So we don't think that we might have a heart attack even if we're a smoker, or we always think we're a better driver than other people. So why is this? Based on the information available to us, often our reasoning process induces us to think that a hazard in question is not really a risk. This is especially true the more we know about the hazard because we feel we have control over it. This is called optimism bias. It's basically the idea of it won't happen to me. When we minimize risk, this is called attenuation. This attenuation may lead to potentially serious adverse consequences by underestimation and under-response. This means that we actually may take certain risk because we've decided a negative consequence won't happen. It's kind of a crazy way that we deal with things. If we didn't attenuate at least some risk, we'd probably never leave our houses because we'd be afraid of everything. The problem is that when people underestimate risks because they believe themselves to be safe and invulnerable, it also means they don't behave in ways that protect them. When you feel safe, you don't feel obligated to do anything else. And this leads to a divide between what experts might say is risky and what the public might identify as most important. So let's talk a little bit about what happens when we do feel threatened, like we do in a crisis like COVID-19, and some of the factors that might increase or decrease our feelings of risk. We estimate risk, especially in a crisis, based on a list of things. We do this mostly unconsciously, but there are some things that actually make us underestimate that risk or attenuate it, and some things that make us overestimate the risk. I'm not going to talk about all of these things, but I do want to highlight a few that I think are most important in the context of COVID-19. The first two are control and choice. So think about driving. Most people feel safe when they drive rather than ride in a passenger seat, because if we have control over the car, we don't think there is as much risk. A risk that we choose to take seems less hazardous than one that is imposed upon us. Just think of your own behavior and then think about whether that's true. Similarly, if we have a choice to do something like texting and driving, if we have control over the situation, our optimism bias is present and we don't think that anything bad will happen. So control and choice over the process that determines the risk will probably not appear as great as when that control and choice are not there. Think about it in the context of COVID-19. At the beginning of the epidemic, especially on the East or West Coast, we were not given a lot of control or choice. There were places were closed. We were told to stay home. There were curfews in many areas. These actions take away that control, and thus our risk was heightened during that time. As things eased, however, and more control and choice were provided, that risk starts to lessen, and the perceived risk starts to go down, making us less likely to do what we should to protect ourselves. Next is whether it's a new risk or one that we have high awareness of. So new or exotic risks tend to be more alarming than those we have experience with. At the beginning of COVID-19, it was new and scary, and our risk was heightened. Similarly, the more aware we are of a risk, the better we perceive it and the more concerned we are. So breast cancer, for instance, versus something that it's very rare that we've never heard of. This awareness is often driven by the media or other informal sources of information. So again, at the beginning of the pandemic, we couldn't get away from hearing information about COVID-19, and our risk was heightened. As things go on, however, the less new and exotic it becomes, and then it becomes harder to maintain that feeling of heightened risk. The next is whether we believe there's a possibility of personal impact. Any risk can seem greater to us if we or others close to us are the victims. This is why statistical probability is often irrelevant in the public's view, and why in certain geographic areas that were hardest hit, the sense of risk is higher. Now you're starting to see that risk increase in other parts of the United States and that are just starting to get hit with COVID. But again, this is hard to sustain long term. Trust and fairness are also really important. The more confidence we have in those responsible for our protection, the less we feel concerned. The less we trust them, the greater the concern. And this may be different for different groups or people. With COVID-19, much has been politicized and the messages have been very mixed. So this affects feelings of trust and fairness in the process. This may cause some to have heightened risk and some lower risk, and that's probably why you see such differences in behavior across the country. Also, people who have to face greater risks than others and aren't benefited in some way look at risk as higher. So those communities that are hardest hit by the epidemic are going to also have a heightened sense of risk. Finally, just the process is a factor. This is similar to trust and fairness in that agencies and governments, from the feds all the way down to the local, must demonstrate trustworthiness, honesty, and concerns about the impacts of risk. If not, risk perception is negative and trust is less. So things like mixed messages about data testing, school reopenings, shortages of COVID tests, and who's able to get one or not are all things that impact trust. However, it's important to note that there is a time at which not trusting the process just makes people give up and not care what happens. Outrage and fear can only go on so long. So I want to finish the talk specifically about how all of these things affect our responses to COVID-19. I'm sure we all remember at the beginning of March, and as things moved forward through May, much of the country was on lockdown. We saw lots of images on the news, in papers, and on social media with healthcare workers, people in mass graves being dug, all of these things. We also have lots of messages and communication about how to protect ourselves. It was, and still is, everywhere. We also have had so much media coverage, 24/7, with lots of people talking and lots of people saying different kinds of things. The problem with this coverage, though, is people have short attention spans. And in a crisis especially, they have actually a very hard time processing information. It's estimated that people can only pay attention for about 20 seconds in a high concern situation at any one time. So being bombarded with information from so many places for so long actually has the opposite effect, and we start to tune things out. So what are the consequences of that? All the factors I've talked about affect public response to COVID-19, but there are a few things that have uniquely affected the public's behavior. I think there are really two basic reasons people aren't doing what we want them to do. First is all the mixed messaging and poor communication that has happened since really the beginning. We had communication happening from multiple sources, and much of it was contradictory. The second is just time. It's very hard to sustain a sense of heightened risk for a long period of time. So first, just think about all the mixed messages we've gotten, from the extent and spread of the disease to whether masks should or should not be worn. These mixed messages create an atmosphere of uncertainty and make it hard for people to believe anything or to pay attention, especially if we are in the part of the country that hadn't really been affected. People just don't really see the point. On top of that, tick-tock. Time goes on, and we want to get back to normal, to a state of optimism bias. As we moved into the summer and now into the fall, we started to see a lot more pushback about complying with directives. Again, people can only have a heightened sense of risk for so long. The longer it goes, even as we are racking up deaths, the harder it is to stay in that heightened sense. The more we start to say to ourselves, well, it's okay if I go to my friend's house for a birthday party, or go to a bar when I'm on vacation, or go to a college party with my new college friends. These are all normal activities and people want to feel normal. Overall, risk perception is a really tricky thing. The public will generally comply with directives if they feel they're personally affected and that they have little control or choice, and if they can trust the information they're getting. Also, if it doesn't go on too long. If they're in a state of crisis, they want to protect themselves. But if any of those things are affected, and the longer something goes on, the harder it is to be prepared and stay prepared. So I'll end with this. Public health events can be scary, and people can be seriously affected by negative risk perception to the point at which they are either so scared that they don't comply or not scared enough that they don't comply. Risk and crisis communication are important to counteract this, but this can be really difficult in a 24/7 news cycle where there are multiple messages and multiple messengers, changing messages and contradictory messages. It's why COVID has been so challenging and why it has been difficult to get people to do what you want them to do. Despite everything, we have real heroes in this fight. So let's hope that we can learn from our mistakes and are able to give these heroes a much needed break. Then perhaps we can all get back to normal and our sense of optimism bias. Thanks so much for listening. If you're interested in the work that I'm doing in my lab, please reach out or look at our website or social media channels. Take care, and remember, wearing a mask protects you from others and others from you. It really is a small thing that has big rewards. So stay safe and healthy.